Rabies: symptoms, causes, vaccine, treatment, and prevention. Rabies is a dangerous virus that causes brain inflammation in humans and other mammals. Animals carrying the infection can spread rabies to humans through bites and scratches. However, it is treatable if a person who has had exposure to rabies seeks immediate medical attention. Since the 1970s, advances in medicine, awareness, and vaccination programs have reduced the incidence of rabies. However, the disease remains a problem worldwide and causes tens of thousands of deaths annually, mostly in rural areas of Southeast Asia and Africa. Of all infections involving rabies, 99% occur due to dog bites. Here are some facts about rabies. Rabies is a viral disease that nearly always occurs due to transmission by an animal bite carrying the infection. Anyone who receives a bite in a geographical area where rabies occurs should seek immediate treatment. Symptoms include neurological problems and a fear of light and water. Following the vaccination requirements for pets helps prevent and control rabies. Smith Collection/Gado/Getty Images. Rabies is a viral infection that primarily spreads through a bite from an infected animal. Once inside the nervous system, the virus produces acute inflammation of the brain. The first type, furious or encephalitic rabies, occurs in 80% of human cases, and a person with it is more likely to experience hyperactivity and hydrophobia. The second type, called paralytic or dumb rabies, causes paralysis as a dominant symptom. Transmission rabies is most common in countries where stray dogs are present in large numbers, with Asia and Africa accounting for 95% of cases. As saliva carries the virus, rabies can develop if an infected animal bites someone. It can also occur if saliva from an infected animal gets into an open wound or through a mucous membrane, such as the eyes or mouth. Any mammal can harbor and transmit the virus, but smaller mammals, such as rodents, rarely become infected or transmit rabies. Death incubation. Incubation is the time before symptoms appear. It usually lasts from 2 to 3 months and varies from 1 week to 1 year, depending on where the virus entered the body and the number of viral particles involved. The closer the bite is to the brain, the sooner the effects are likely to appear. Anyone who has exposure to the virus should seek medical help immediately, without waiting for symptoms. Discomfort at the site of the bite. Acute neurologic period. During this stage, neurologic symptoms develop, including confusion and aggression. Coma and death. A person may enter a coma, and most people then die within 3 days. People used to call rabies hydrophobia because it appears to cause a fear of water. The reason is that the infection causes intense spasms in the throat when a person tries to swallow. Diagnosis. If doctors are not certain that an individual received a bite from an animal infected with rabies, they typically must exclude other conditions first. For this reason, the individual usually starts a course of prophylactic treatment immediately without waiting for a confirmed diagnosis. If a person develops symptoms of viral encephalitis following an animal bite, doctors should treat them as if they may have rabies. Treatment. If a person has a bite or scratch from an animal that may have rabies, or if the animal licks an open wound, the individual should immediately wash any bites and scratches for 15 minutes with soapy water, povidone iodine, or detergent. After exposure and before symptoms begin, a series of shots can treat potential rabies infections. Because doctors do not usually know whether the animal had rabies, it is safer to assume that they do and begin vaccination. A small number of people have survived rabies, but most cases are fatal once symptoms develop, and there is no effective treatment at this stage. Instead, healthcare professionals will usually try and make a person with symptoms as comfortable as possible. Instead, they reserve it for those at high risk of rabies exposure, such as a laboratory staff working with the virus that causes the disease, veterinarians, and people likely to receive animal bites. Other people may receive the vaccine following exposure to the virus after an animal bite. Rabies vaccine contains an inactivated or a harmless version of the rabies virus, so it cannot cause the disease. It triggers the immune response to produce antibodies, which remain in the body and help protect against future rabies infections. Pre-exposure protection requires 3 doses of rabies vaccine across 28 days. For post-exposure protection, previously unvaccinated people need 4 doses of the rabies vaccine, plus rabies immune globulin, RIG. Prevention. Rabies is a serious disease, but individuals and governments can take steps to prevent infections. Vaccinate pets. Find out how often to vaccinate cats, dogs, ferrets, and other domestic or farm animals, and keep the vaccinations up to date. Find out how often to vaccinate cats, dogs, ferrets, and other domestic or farm animals, and keep the vaccinations up to date. Protect small pets. Some pets cannot have vaccinations, so their owners must prevent contact with wild animals. Some pets cannot have vaccinations, so their owners must prevent contact with wild animals. Do not approach wild animals. Animals with rabies are likely to be less cautious than usual and may approach people. Animals with rabies are likely to be less cautious than usual and may approach people. Nevertheless, between 30,000 and 60,000 people seek rabies post-exposure prophylaxis every year, following contact with suspect animals. Anyone traveling to an area where rabies is prevalent or participating in activities where they are likely to come into contact with wild animals, such as caving or camping, should ask their doctor about vaccinations.